4 primary schools complete disaster emergency plans, Caribbean Wellness Month launched with a church service, and public servants work for lupus. Thank you for joining us on National Focus. I'm Kerdisha St. Louis.
And I'm Lourianne Graham Carter. Stay with us for details of these and other stories after this.
Think water, think life. Water refreshes, restores, cleans, and enhances growth. Potable water is a benchmark for development. DOWASCO is serious about its mandate to ensure easy access to potable water island-wide and provide sewage services for a cleaner environment. DOWASCO is your water and sewage company.
Thanks for staying with us. 4 primary schools on the island are now better prepared to deal with emergencies in the event of a disaster. At the Ministry of Education's principals meeting held last Friday, principals of the Coliho, Dubla, Massac, and St. John's primary schools received school emergency plans. The Strengthening Resilience and Coping Capacities in the Caribbean through Integral Early Warning Systems Project, or simply the Early Warning Systems Project, was conducted by United Nations Development Program, or UNDP consultant Clement Richards, with the assistance of Wayne Abraham from January 5th to June 31st, 2016.
Both Mr. Abraham and myself served as education coordinators for this project, with Mr. Abraham focusing on the production of community-developed disaster plans for Dubla and Coliho, while I concentrated on creating school emergency operation plans, or CEOPs, for the Dubla and Coliho schools, as well as the St. John's and Massac primary schools. Time does not allow for a review of this project here, but with regards to the production of the school emergency plans, this can only be described as having been an unqualified and outstanding success. Not only were we able to develop the plans which were required, but in the process we refined an approach to what I like to refer to as school DDR, or school disaster risk reduction, with scores of teachers and hundreds of students involved in the process.
Richard said despite the added pressure of Tropical Storm Erica and the skepticism of the principals and staff of the schools, the project had a quote unqualified success.
Although the post-Erica situation placed additional work pressures because of the times which schools lost, this case was very different, very, very different. In each of the cases, there was quite a lot of interest, and teachers wanted answers to questions as, what should I do if a tsunami is approaching? And in many cases, others reiterated sentiments like, quote, all you can say what all you want, but if something happening, I'm not staying in the school. I'm going to get my child. However, while this may sound amusing, this is a very real concern, which among others were addressed during this consultancy.
Among other pertinent issues, the Early Warning Systems Project addressed the responsibility of teachers to their schools versus the responsibility to their homes during a disaster. The project stipulates that staff members are expected to develop an emergency plan for both their homes and schools. Besides the staff, students and parents also participated in the project. The Honorable Minister for Education, Peter Seja, welcomed the initiative, saying it falls into the plan of the ministry to foster safer, friendlier schools.
One other program that we have had tremendous success, and we have seen a change in the attitudes of our students, is the Child-Friendly School Initiative. And this year, we will be focusing our attention on disaster risk management and our school emergency plan. And of course, Mr. Richards, I want to thank you for the manner in which you have conducted the task that you were assigned, working with our various principals, and schools. And let me give you the assurance that the Ministry of Education will be better off by implementing this project.
The project was conducted through the Office of Disaster Management with funding from the European Commission, Humanitarian Aid and Civil Protection Organization, ECHO, through the UNDP.
In other news, Principal Nursing Officer Caesarian Farrell is commending the government of Dominica for their various initiatives to assist the nursing workforce.
Notwithstanding these health care demands and the continued efforts of the Ministry of Health to build human resource capacity, there continues to be a challenge, mainly due to issues of attrition. Nursing shortage has been a global phenomenon for several years, and Dominica has been no exception. In the face of the challenges of nurse attrition, the government of Dominica has introduced several initiatives to support the nursing workforce, to include strengthening the educational infrastructure for training nurses and nursing collaborators from the Cuban Technical Assistance Program. However, it is recognized that the recruitment of nurses to fill vacant nursing positions is largely dependent on the local market, as most nursing applicants are graduates of our own local Dominica State College. Therefore, a continuous supply of trained nurses is critical to sustain the workforce, and initiatives aimed at attracting and supporting the continuous production and development of nursing professionals is significant and of national importance.
She was addressing the first ever Agnes W. Brooks Nursing Scholarship presentation to 3 final year professional nursing students last week.
The Ministry of Health and Environment has for the 9th year launched Caribbean Wellness Month 2016. This year, for the first time, activities were kicked off with a church service. The month of activities will be observed from September 5th to October 1st under the theme, Love That Body Glow Through the Years. Saturday, 10th September was observed as Caribbean Wellness Day and was celebrated at the Bethel Seventh-day Adventist Church in Canefield. Attending the church service were health officials such as the Chief Medical Officer, Dr. David Johnson, Coordinator of the Health Promotions Unit, Athelina James, and NCD Commission Chairperson, Health Coordinator of the Eastern Caribbean SDA Conference, Ms. Priscilla Prevost. In his address, Dr. Johnson identified the church as an integral contributor to the health of the community.
Healthcare providers are very often involved with the technical aspects of providing health services, but no one can doubt that other groups and persons like the church play a significant part in addressing the ill in our communities and in our nation. It is great that the church is working side by side with officials of the ministry to provide improved health care to the persons in the community. The saying that it takes a village to raise a child, in my mind, should be extended to include that it takes the church and the wider community to care for the sick and shut-in and to prevent and to protect the health of the nation.
The Chief Medical Officer reported that Dominica is among countries in the region facing the worst epidemic of chronic non-communicable diseases.
It is well documented that tobacco use, the abuse of alcohol, lack of physical activity, inappropriate diet, and obesity, which is in itself associated with the lack of physical activity and with improper eating habits, are among the main modifiable, I emphasize modifiable, some people may say preventable, behavioral risk factors that cause the chronic non-communicable diseases. To put it simply, most of the things that increase our chances of suffering from heart diseases, stroke, cancer, diabetes, and chronic lung diseases are things that we ourselves have some sort of control over. All of these diseases, which in fact can all be prevented, lead to the loss of life, significant loss of productivity by affecting the workforce, can lead to poor quality of life, and are sending up the cost of providing health care in Dominica.
Over the past 30 years, these conditions have been identified as the main causes of death and disability in Dominica and the region. The main objective of Caribbean Wellness Month is to address the main risk factors to NCDs, which are unhealthy foods, physical inactivity, tobacco, alcohol use, and most recently, stress. Dr. Johnson believes that cancer shouldn't be a major factor in Dominica. He gave steps to address the most prevalent types.
No woman in Dominica should be dying from cervical cancer. A pap smear can be done by almost any nurse or doctor in any of our 52 health centers all over the island. If our ladies do their pap smear regularly, then the early signs of cervical cancer can be detected. And treatment can be done on time without any of the women having to die from cervical cancer. Mammogram, that is a special X-ray for the breast, is done at the Princess Margaret Hospital. Ladies are therefore encouraged to do their self-breast examination regularly and to see the nurses and doctors so that they could be advised if they need to have any special tests done.
The observance of Caribbean Wellness Day began in 2008 following the September 15, 2007 declaration of Port of Spain, where heads of government met to take action to control the pandemic of non-communicable diseases.
Kerdisha, did you know that the Prime Minister, the Honorable Dr. Roosevelt Skerrit, was chair of that delegation, which led to the region, the Caribbean region, addressing this very serious issue of non-communicable diseases? That's
right, Lourianne. And you know, just recently, you know, that the government, specifically the Prime Minister, passed a bill which, you know, exempts the increased the increased importation of confectionaries, which we know are very unhealthy and can seriously damage the health of nationals and increase the amount of non-communicable diseases on island.
So true, so true. And even government is working with PAHO to host workshops to inform them on how they can inform the public to make people more aware of non-communicable diseases and how they can address them, how they can prevent them as well.
That's right. And you know, the Prime Minister always says the wealth of a country is its health, so we can definitely see that the government is working to help nationals take control of their health and have better lives.
So true. So now it's up to us, the community, to work on ourselves, eat healthy and live healthier lifestyles. The Ross University School of Medicine in Dominica on Friday held a ceremony for the donning of white coats on the new class of 2020 at the institution in Picard, Portsmouth. Attending the ceremony was the acting Prime Minister, Honorable Reginald Austrie, Honorable Parliamentary Representative for the Portsmouth constituency, Ian Douglas, Honorable Minister for Tourism and Urban Renewal, Senator Robert Tong, and U.S. Ambassador to Barbados and the Eastern Caribbean, Her Excellency Linda Tagliatella. Honorable Douglas welcomed the class of 2020.
You are pursuing your medical career in an absolutely wonderful place, and we have continued together the partnership, corporate community partnership between Ross University and the Portsmouth and Dominica. We have continued to invest in the infrastructure, in the services. You will find some of the best services in Dominica available here in Picard, and all of that is geared towards making your stay here, your sojourn here, a success.
Past student of the Ross University School of Medicine, class of 2010, Dr. Hussein El Halis, gave the keynote address.
You will struggle to master one of the most difficult fields of study, medicine. You will fight against the reputations others may assign Caribbean medical students. Prove them its merit with your knowledge and skills. Be persistent and see this not as a wall to block your path, but as a challenge to overcome. As William Osler, regarded by many as the father of modern medicine, once said, we are here to add what we can to life, not to get what we can from life. So I was asked recently, where will I go next in my career? My response is that I've arrived. I improve the vision of patients every single day. As a cornea specialist, I perform cornea transplant surgeries and have reversed many instances of severe vision impairment. What could be more incredible than curing blindness and giving the gift of sight? My journey, like yours is now, started here in Ross University.
You're watching National Focus. More when we return.
Let's have some fun, eh?
I'm not ready for your kind of fun yet.
But everybody else is doing it.
But I'm not everybody else. I'm me, and I want to do well in school.
Well, you definitely get an A for attitude.
I plan to get an A in life, and then I'll think of your kind of fun.
So what am I to do in the meantime?
You'll survive.
Say no when you're not ready.
Welcome back. Organizers of the 19th World Creole Music Festival have already issued a statement regarding antisocial behavior during the upcoming festive season. The growing festival in 18 years has never had any incidents of violence. Promoter Val Coffey addressed violators directly at a press conference last week.
Every time that we have any major event in Dominica, be it cricket, a major football tournament or festival of that magnitude, we work directly with the Office of the Commissioner of Police. Superintendent Valentine has been assigned with us this year. There's always a master plan in terms of the security network, which we really cannot give you all the details on, but I can assure you that we'll be protecting the land, we'll be protecting the sea, we'll be protecting every aspect of Dominica. We at DFC can assure the thieves, we can assure the rapists, we can assure those who are going to create problems that there will be zero tolerance for your ignorance. So get your act together. If you have to do your absolution or you do your confessions, do that now. You are not going to make this festival a problem for Dominica. So take your crime, take your bad attitudes, take it elsewhere. The same way we always say, if you come into the festival, please don't use that opportunity to fight with your girlfriend. We have never had a fight. We have never had any incidents to warrant us any bad image. Please, not this year. This event, the show of support from the government is a clear indication that they want to make Dominica's festival, to make Dominicans feel at home. So when they come, our visitors, when our Dominicans return home, it should be something about love. We need to protect each other, and we need to protect this dynasty, which is Dominica.
Coffey has revealed that a security company has been contracted for maximum protection and measures are being finalized for crowd control.
And a number of public servants turned out on Saturday, September 10th to walk with the aim of raising awareness of the lupus disease. Lupus is an autoimmune disease that affects mostly women of African descent of childbearing age. The disease can attack any organ and can cause chronic pain and debilitating physical and emotional alterations. The walk for lupus commenced at the Pottersville Savannah. Wearing purple and carrying placards, participants walked through the Goodwill Link Bridge, Hillsborough Street and Cork Street and ended at the Bayfront. Coordinator of the Health Promotion Unit, Athenia James, addressed the public servants at the end of the walk.
This, in a way, is also part of Caribbean Wellness Month, where we raise awareness on chronic diseases among the Dominican public. This happens all across the Caribbean, and today is Caribbean Wellness Day. Today raises awareness and sensitizes people about the chronic diseases. We normally focus on the diabetes, the cancers, high blood pressure and so on, but lupus is an up and coming disease that persons need to be aware of. So I'm very happy to be associated with this organization and with this activity.
She thanked those who turned out to participate and expressed hope for more activities such as this. The walk was a collaborative effort between the Ministry of Health and the Lupus Foundation and forms part of Public Service Day Celebration 2016. All proceeds of the walk will go to the Lupus Foundation. Coming up next, your Creole highlights with McPherson St. Luce.
Alors tout le monde, bienvenue à cette nouvelle en créole, non moins c'est McPherson St. Luce. Premièrement, travail qui a commencé à ce projet en territoire Kalinago. En une semaine passée, le ministre a reçu matériel de Korea pour le projet ça. Parole ça là sorti du ministre Kalinago, Honorable Cassius Darrow.
L'agence salariale en Ministry Housing, nous devons supposer déjà commencer le projet, nous supposé déjà fini, mais on sait nous avons visité nos Erika et fait autant dommage pour redirect le bagage comme ça tout le monde a manière à passer mais ça moi ça actuellement c'est l'argent là nous avons plan nous avons tout bagage en place la semaine là nous tenons team hot Agos Dominica vini entre Kalinago, territoire Kalinago pour nous garder ces places là. Ça nous qui a fait 6 semaines prochaines à venir, c'est pour faire ces fondations là. Les agos venir avec comment dire ça concrète là pour ça nous vider pour nous ça level et at least Bob finish pour moi ça nous avons 6 cailles qui complète. Et tout ce monde ça c'est monde qui chapitre à l'âge 70 years plus.
Une nouvelle, toi étudiant qui attendait faculté sciences State College Dominique, recevez scholarship votre conseil général North Dominique, d'une faculté sciences Beverly Liblan, fait parole que State College Dominique a complimenté conseil North Dominique pour support ailleurs.
Nous nous avons fait venir à toute place, tout le monde Dominique. Et bien là, ils viennent, ils ont différentes difficultés, et bien ça nous a gardé compte pour ces enfants to ensure qu'ils pas tomber, ils pas aller, ils pas rester derrière. Et bien ils viennent, ils apprennent ça, ils viennent apprendre. On dit c'est un bon exemple qu'on d'autres monde qui gardé pour ces enfants qu'a fait, et bien ils ont mettre l'argent pour ensure ces enfants là oui finir éducation. So State College dit merci pour nursing council. Et bien nous hope association teacher qui veut need là et bien bas scholarship pour teachers qui aller à l'école parce que les teachers là aussi yo pas tout teacher qui ça really payer l'école fee et bien just qu'on nursing council ça bas scholarship pour ces nurses là association teachers savoir you also mettre l'argent pour aider ces teachers là qui viennent college qui passent à payer les filles l'école. So State College nous veut dire merci pour nursing council et nous commander tout le monde, tout business de à Dominique si yo ça aider les enfants fini éducation yo que ça build Dominique parce que c'est pas tout seul responsabilité gouvernement, c'est responsabilité nous tout pour éduquer nation là.
Et puis finalement, le gouvernement Dominique mettait l'argent en aide banque assister secteur hôtel, restaurant et puis agriculture. L'argent ça là sorti du Citizenship by Investment Program. C'est le ministère Investment, Honorable Dr. John Colin McIntyre. Programme ça là c'est en l'intérêt PA.
You parle comme restaurants pour lever yo because it is jeune puis yo. On dit yo sans besoin pour faire place primaire pour lever place. Yo dit ok moi besoin ça. Il devenu pour $12 million, 12 millions qui ça right. Mais il dit ok ça passe. OK base 15 millions. So il buy ça. And il can make 3% interest et puis yon année pour grace period pas ni pour payer. And ça qui manger tout ces hôtel nous parce que c'est petit là qui manger yo. And il need d'autres pour restaurant. Non, ça c'est à 8 banques là, il dit là il finit budget là, il fait ça vite, il fait ça déjà. Pour agriculture, il dit ok nous qui mettons où ça nous bail petit agrochemicals, pile monde pour travail bas, gagner ça, et toujours on loue l'argent. So il mettait another 10 millions l'argent là encore. Même bagaille 3% interest et puis 6 mois pour pas payer et bien vous commencer à payer après ça.
Messieurs, mesdames, ça c'est tout pour nouvelle à Créole pour à présent. Non, moi c'est McPherson Luce. Au revoir.
And that's the news. Coming up next, today's tip.
Children, yell and tell. If someone tries to abuse you, tell until someone believes you and they do something about it.
For more information on child abuse or to report suspected cases on child abuse, contact the Social Welfare Division on 33 Great Marlborough Street or call 266-3020 or 266-3080.
In today's tip, we'll discuss how you can make time for yourself. Balancing work, family, and friends can be challenging. Sometimes it may seem like you barely have enough time or energy to do the things that you have to do, much less the things you want to do. But making time for yourself is important, so here's a tip to help you out.
Decide that making time for yourself is important, and don't feel guilty about doing something for yourself. It is not selfish to make time for you. It is actually good for the other people in your life. When you feel positive, your relationships with others are more positive too. That's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm.
Like our Facebook page, facebook.com/GIS News Dominica, and follow our Twitter at GIS Dominica.
You can also catch up on our past National Focus newscasts on our GIS Dominica YouTube channel. Live streaming is now available also on our YouTube channel 24 hours a day. From all of us here on the GIS production team, I am Lourianne Graham Carter.
And I'm Kerdisha St. Louis. Thanks for watching and join us again next time on National Focus.